Here in Vet Life Reimagined, we talk about mentorship and support because they're essential to thriving in veterinary medicine. The Ready Vet Go mentorship program helps early career veterinarians confidently transition from student to successful practitioner with real world guidance on communication, time management, well being, and case discussions. It's perfect for individuals or practices without a formal mentorship program. Enrollment for the October cohort closes Friday, September 12th. Use code SPRINKLE for 10% off at Ready Vet Go. Link in the show notes. That's code SPRINKLE, SPRINKLE.
I was terrified a little bit. I mean, I've been practicing for years. I had a very well-established practice and caseload and income, and just like, I'm going to leave all this and do something completely different.
Welcome to Vet Life Reimagined. Today, I'm joined by an incredible guest, Dr. Rebecca Windsor, a board-certified veterinary neurologist who has not only made her mark in specialty practice, but is now pioneering the future of regenerative medicine as Director of Veterinary Affairs at Gallant. And if you like this episode, I recommend listening to the episode with Dr. Linda Black, the CEO of Gallant. That is one of our most downloaded episodes. But today, I think Dr. Windsor's journey will inspire you. From long hours in practice as a neurosurgeon and leading research with Ethos, to her new position in communicating the impact of regenerative medicine at Gallant, she's proof that careers in veterinary medicine can evolve in powerful and unexpected ways. In this conversation, you'll hear how she's helping bring new hope to conditions once thought untreatable, what it really looks like to blend research with clinical impact, and how she navigated the transition from specialty practice to industry. And I hope you stay until the end because we talk about certain family priorities that aren't discussed as much as maybe they should be. So let's get to the conversation with Dr. Rebecca Windsor. When did you know you were interested in veterinary medicine?
Great. Thank you, Megan. I'm so grateful to be here. I love what you've done. And so I'm just honored to be a part of this. So yeah, thinking back, so I was trying to think of this. I would say that I've always had an interest in medicine. And so even starting like as a child, my mom would make fun of me because I would like go get like dead animals out of the yard and like put their skeletons back together. And I was like, other girls were playing with dolls and I had like microscope sets and stuff. So we're always really interested in science and medicine. And then I went to a high school called the Illinois Math and Science Academy, which is cool as it sounds, but there is lots of really great benefits to going there. And one of them was every Wednesday we got to leave our campus. So we boarded there and we had book us to various different places depending on what our interest was. So they already were trying to gear us towards college and what we wanted to do professionally, like even at that young age. And so I started going to a human hospital that wasn't too far. Honestly, I think a lot of my path and everybody's is influenced by mentors that we have, at different points along the way. And so I worked with an amazing doctor there. He's actually a rheumatologist, and he was able to get me connected with a couple other doctors with that hospital. And then also, and I was trying to remember how this connection happened, and I honestly don't even remember it did, but he got me starting doing my days of rotation at the Brookfield Zoo. And so I went there and I now work with small animals, but I was just fascinated by everything that they did and just really felt so stimulated by like the thought of veterinary medicine and doing that as kind of a different path of what I thought, I would do. I thought I was just going to go into human medicine. And then the other interesting connect is that even though I was in Illinois, the doctors there were all UC Davis trained veterinarians. And so I was able to talk to them a lot. They had such great things to say about UC Davis. And then I started almost just like having this little life plan, like how do I get myself to California? And then I can get in-state, residency and then go to Davis. And so a lot of just even those initial visits with those people at the zoo were so impactful. So, and then once I, kind of went along the path of veterinary medicine, I changed more to being small animal, but I think that was definitely solidified me wanting to make that change. So
Very cool. So how did you get to California? Did you get there before vet school or?
yes, yes, so I was able to actually get a full tuition academic scholar at the University of Southern California. So once that happened, there was like no other choices in my parents' mind as to where I would go to college, because if I could go somewhere for free. So that's where I went for college, which I loved. However, it's not free to live Los Angeles, as you can imagine. So despite having my tuition paid for, I have expenses just living there, having a fun life there. And so I actually had to work my way through college quite a bit. And so looking back on this, I don't even know how I did this, but I still have a full scholastic load. And then I worked at 2 different small animal practices throughout college, mostly to my final year of college, would be in school all day. And then on Wednesdays and Fridays, I would work from 1 to 9 at one practice. And then on Saturdays and Sundays, I would work from 7 a.m. to midnight at another practice. I don't even know if that's legal to work that many hours, but I was just like young and excited and able to, work in a technical capacity without having to, become an RVT. So things are more lax then as far as what they let people do. But I need that experience because not only did I get to work with small animals, but I honestly think it really put me in touch with like what the nurses go through doing those shifts all day long. It's hard work. It's a lot of talking to people. It's a lot of not gratitude and not good pay. And like, I think that set me up really well for the rest of my career and how I was able to work with my team to really just kind of understand where they're coming from and how hard it is to kind of work at that level. I also had great doctors that mentored also UC Davis grad. So I had this like UC Davis path kind of set, I think. And so it was with all of their support, that I ended up applying to Davis and stayed in California. So.
Yeah. When you started vet school, and of course, by the time you ended, what was your interest? What did you think your career and life was going to look like at the beginning? And how did that evolve through, your years at vet school?
Yeah. Well, I've always been a neurophile. So I think there's some of us who are just like neuro from the get-go. I was an undergrad in neuroscience major, so I had that strong interest. But I really liked surgery too. And I know neurology has a lot of with it, but the meeting wasn't quite sure if I wanted to do surgery or neurology, but it wasn't too long after being at Davis that I got pretty set. Part of that is honestly the faculty there is unbelievable. I mean, they're so supportive. The courses are amazing. And so I'm actually able to start working with them pretty early. I think I'm even my first year as a student at Davis. They had something called the treatment program. I can't remember the exact, but essentially they had students that would come in and help with the treatments for the neurology patients because there were always so many of them and they were so labor intensive, use down dogs and stuff. And so we had this treatment program where we ended up having different people assigned. I ended up running that program, for a couple of years where different people were assigned every day to come in to help the neurology residents with all of their patients. And so I was able to really get a feel for like the life, you know what I mean? And what the patients are like, what the work's like. Just had a really strong, passion for it and was able to work with the neuro team there as well, helping set up a database for them that had a lot of like videos. So I was able to really start looking like almost like studying different diseases and stuff, early on. And so kind of sold, I think, from the beginning, to want to do neurology there.
Now, you mentioned that your husband is a veterinary surgeon too. Did you meet him during vet school?
I met him during my residency, actually. So yeah,
Residency, okay.
I think a lot of people, like veterinarians end up with veterinarians just because of like, who are you around? But I was really blessed because we met at the same time. Like we were first year residents at Davis at the same time. And so it was nice because then we kind of had the same path. Like it's oftentimes hard to try to coordinate when you're different years apart and stuff. But yeah, I definitely kind of like a love at first sight type of thing. And but it's not easy trying to navigate a relationship with another resident during a residency. And it's like hours and stressful and like working on that out. But I think we did a good job. We still continue to do a good job, but it is like it's intense. You're a little pressure cooker, situation there. So yeah.
Yeah. I've interviewed quite a few vets who have married vets, and everybody has their unique way of doing things. But yeah, you have to kind of balance too that you don't talk too much about work or just you have the right balance for each other. But yeah, definitely. And then also thinking about eventually having a family with 2 very intense careers can be challenging as well. And I think we'll probably get there. But after your residency, I mean, my understanding of neurology, maybe it's similar to a lot of the other specialties, but what were potential options that you saw that you could, go into after residency? And which one seemed more like where you wanted to head and why?
Yeah, I'll be honest, I was really torn. I've always really loved research and I've always really loved teaching. And so I was really torn whether to stay in academia versus going into private practice. I really loved was like working with people, working with the animals, and I really like high pace, high volume. And so when I came on my residency in 2009, we decided to just look for private practice things. And we'll probably get into this a little bit later, but things like now as well, where you don't have to have one or the other. You could do so much with teaching and research now in practice. But when I came up in 2009, that wasn't really happening. Like you either stayed in academia, or you went into private practice. We also came out of a little bit of a tough time, like the economy had kind of crashed at that point. And so, whereas now I feel like a lot of the residents can come out and they're just like getting handed off and signing bonuses and stuff. For us, like there wasn't a lot of people hiring. And, given that my husband needed a job, I needed a job, we were kind of trying to scramble to find something that would fit for both of us. So, and then ultimately was able to kind of make everything work. But at the beginning, I know it was hard. I felt like I was somehow like sacrificing something or letting myself down, you know what I mean, by leaving academia. And I do feel like a lot of pressure get on veterinarians for that. And, I think things are, like I said, are changing, which is good.
Yeah. So, like you said, that there's a lot of opportunities to bring some of those elements into private practice. How are you able to do that? If you don't mind kind of sharing your journey through private practice and how you were able to implement that.
Yeah, absolutely. So I've been in private practice, but some of those years was like family and stuff like that. And so that'd be a bit of a priority. And once I got though, I'm currently in Colorado at Wheat Ridge Animal Hospital. After being there for a couple years and my kids were like a little older and had better sleep, you know what I mean? More brain power. I really started feeling like at that stage in my career that I really wanted to find a way to bring the research all back. It was something that I really missed. And at the time, our hospital was part of the Ethos Veterinary Health Network. And so Ethos Veterinary Health group called Ethos Discovery. And so that's essentially a nonprofit research organization that's associated with Ethos Veterinary Health. And the nice thing about that organization is that we look for problems that doctors face like on a day-to-day basis, like, hey, this is something that I'm having trouble diagnosing or differentiating. Can you help me find a way to solve this problem? And we design all of our projects around the problems, right? Versus like, hey, this is a drug I made and I want to see if it works. You know what I mean? So it's just kind of a different way to go about it. So I was so blessed because I was able to start working with that group. It's now been about 6 years. Amazing organization, so well led. And I really just had great mentorship there and realized for so many of us that even like research, we're never really taught, you're kind of given these projects and you just do them. And I'm like, hey, I have this published, but I didn't really know what I was doing, and really being able to learn, how to structure a project, how to do things the right way has been so valuable. And so with that group, I've been able to lead the neurology portfolio and some amazing projects that have been so fulfilling for me just to feel like making a difference in a different way. Not that I don't love the patients, I do, but just to feel like you're trying to solve more global problems and contributing, in that way. And since then, that model has really been adopted a lot of other practices as well. And with some of the mergers, you now have these really massive conglomerations of hospital. Like I know for our group, for example, we have 60 hospitals in the network now. But you look at, Blue Pearl and BCA, and they're doing similar, sorts of things as trying to prioritize research. So it's so nice to see that happening. And there are so many veterinarians in private practice that still really want to be a part of research. And once you have these bigger groups and more hospitals that can contribute cases, it's really amazing the impact, that we can get from research and private practice. And so I've continued to work with that group closely. And it's also allowed me to kind of bring some of the like teaching and mentorship back in, because once I felt like I was comfortable enough that I could teach someone else, I took on the role of the house officer project coordinator. So I help all the house officers kind of learn, how to go about doing their projects and stuff the right way. So all in all, been really rewarding with how much practice residences can do now. And it used to be seen as like a lesser type of residency than academia. And I really think that's shit.
Mhm. I'm glad you brought that up because I specialized in nutrition and we're seeing lots and lots of different ways of doing residencies in our specialty too. And I think you're right. I love their approach to research in that we see a problem. Let's
Mhm.
look at this problem to find a solution. You make it very clinical and practical, which I think for people who think like a private practice veterinarian, you get the best of both worlds. You get to think about clinically how I can solve problems with my patients, and you're able to contribute to a growing data set that can help not only maybe a patient in front of you that you're seeing, but all pets that are potentially having similar issues. So that's pretty exciting. That there are opportunities for equally robust learning opportunities in private practice setting for residencies. And the fact that you have like this program that can accompany that. And again, still make it very practical and relevant. I think that's a really neat thing that we can bring to diversify different ways of learning and continuing our education.
Yep, for sure.
Absolutely. So, I guess during all of that time, I love stories and examples. Was there a
Mhm.
particular problem that you just still remember being very passionate about? Anything that you're just like really proud of to look back on and remember?
Yeah. Well, my proudest thing is kind of like, I feel like it's been going on forever, but it's also very current. So a lot of people who know me know my kind of biggest passion project is, and this was one of the things about Discovery is they kind of brought this to me, 6 years later, like, hey, what do you think about this? And essentially there's a disease that's called necrotizing meningoencephalitis or NME. Everything has very long names in neurology. That disease is most common in the pug. So oftentimes you'll hear the phrase encephalitis to describe that. And so what's so fascinating is if you look at that disease histopathologically and genetically, there's a lot of really strong similarities to the type of multiple sclerosis in humans. And so the question that they kind of brought to me years ago was, hey, do you think it's possible that there's an earlier stage of this very aggressive brain disease in pugs that people are just missing? Because when we appreciate it clinically, the dogs are coming in just crashing and burning. I mean, oftentimes they're coming in, they're seizing, circling, they are so obtunded. Lots of times they can't walk. And even with aggressive therapy, like you maybe get one, at the best, a lot of them are dying within the first few days, 2 weeks. And it's just heartbreaking, really young, cute, adorable pugs, so all of us who have seen this disease is just horrifying. It's essentially 100% fatal, so they brought up this question could be kind of an earlier stage to this because there's earlier stages of MS that kind of go unnoticed. And so they proposed this study design for me. Well, what if we just started examining some young, seemingly healthy pugs? Do they have anything on their exams that are abnormal? That could be maybe an early indicator of this disease. And at first I was like, okay, I'm just gonna go look at a young, healthy bugs. That was good. Like I was skeptical. I didn't think we were gonna find anything. And we started doing these screening clinics in like 2019 to 2020. And I was like floored because we did start seeing very similar set of symptoms, not in a tox, this isn't that common of a disease, but there's really similar set of symptoms we saw across the board in the ones that were abnormal. And so at first we didn't expect to find that. I was like, oh my gosh, we now have abnormal dogs. And so once we kind of recognize like, hey, this very similar pattern. And so the theory is that they're already having these inflammatory changes in the brain that are manifesting the symptoms before they're really overtly manifest anything that the owners would notice at home. And so we started MRIing and doing spinal fluid on these dogs and found that all of them had some early changes on their MRI as well. And then kind of the next phase was like, hey, can we do something to like this and start treating these dogs? And so this all started kind of happening faster than we expected because we now had this group of dogs. Owners knew what the study was, and then they were panicked. They're like, oh my gosh. And so we had always kind of had in our mind we would consider using stem cell for these dogs because oftentimes when are diagnosed, they're just treated with immunosuppressive therapy. We know it doesn't cure the disease, and there's side effects associated with it. And so our thought is, can we do something immunomodulatory and try to kind of reset their immune system? There are a lot of studies looking into using stem cells for MS as well. But there is that the disease course for MS is pretty long. So some of them, if they don't have that aggressive form, it's hard to like monitor and publish some of 30 to 40-year study. So we now have this group of dogs where it happens at a young age that you can start training them. the course of their disease is probably going to be, if you're going to cure them, probably closer to within 3 years. So really kind of a close timeline that we can look to see, do they respond to stem cells? Do they relapse? And so we started using stem cells with partners at UC Davis originally, and we had good connections there, and we're able to get cells from there for a couple of years. And then they had some changes in their lab where they were no longer kind of outsourcing cells. And so this is kind of like a ding, 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 where the next part of my life became connected, and I didn't know at the time it was going to be connected, is that they recommended that we reach Gallant, which is a cell company that's providing donor-sourced stem cells, mainly for their research studies, but then they do some doses to research groups and stuff like that as well. And so they recommended we contacted Gallant, met the team there, started getting cells from them. So worked with their cells for a couple of years. And that whole experience has been one of the most amazing things in my whole career, because I get to work so closely with the families and the pugs, and not about doing research and publications and CVs and stuff like that. And really at the end of the day, that stuff doesn't mean a ton. It's like knowing, like, I took this animal that I was watching just go down like this and gave them a treatment that made them better, and some of them got better and stayed better, some got better and relapsed. When did that happen? Did they respond again to stem cell therapy? And I will say that this whole experience of seeing how they responded, seeing the families, seeing them, like how much better they got, was so impactful for me, that became like clear to everybody that it was what I was most passionate about, continuing that and finding ways to bring this sort of therapy to become more mainstream and the potential benefits. And so it was around this time, probably about a couple years into the study, but when we really were having the results to start presenting, that the team at Gallant reached out to me to see if I'd be interested in coming to work for them as the Director of Veterinary Affairs. And so at the time, though, I will say, and this is just like all on topic of making changes in your career, I was terrified a little bit. I mean, I've been practicing for years. I had a very well-established practice and caseload and income, and just like, I'm going to leave all this and do something completely different. It wasn't an easy decision, but in some way that really was, because of what it was. Like, having the opportunity to educate people about something that I'm really passionate about, to work with a company that is led by some really amazing, strong, brilliant women, kind of be part of that culture and really try to bring things novel, scientifically sound, to the world. And so I'll look back and be like, oh, I should have just, you know what I mean? So I made it. I left clinical practice to a large degree, and came to join Gallant in April here. But yeah, if you had told me, 5 years ago, like, hey, you're ultimately going to leave practice to go into industry position, I would have been like, no, I can't, but things change. So,
Yeah, and I remember you said even your husband was like, "Oh no, you have too good of a gift to leave private practice." And so it's especially hard when your significant other is like, "Well, wait a minute." But as we discussed though, it may seem like it's completely different, but you were still taking all of your talents and your skills and your passion and directing it just slightly different, and helping those patients in a whole nother way. I acknowledge that change is very hard. It is very hard to go from 20 years in a practice setting to being at your desk in front of a computer most of the time. That transition can be hard. And based off of talking with you, it sounded like it was challenging, but so far it has been quite rewarding, especially going back to your family.
For sure. Yeah. Yeah. And I will say that it allowed me to do all the things that I really love. And like, I liked being in clinical practice, but I'll be honest, I was getting burnt out. It's long hours, it's draining. The clients can be draining, the change in the corporate structure of veterinary medicine. And we don't need to go down that rabbit hole either, but that's draining, and so I was finding that like my greatest passion was involved with all of this sort of stuff, educating people. One thing I've always really loved is being able to take things that are hard and try to explain to other people. And so allow me to be able to do that, and create a lot of new content and really like interact a lot with veterinarians. And so I'm a big people person. A lot of what I get to do is still getting to talk to people every day, and so that is like in meetings with my team, but a lot of that, like meeting new veterinarians and talking to them about what we're doing and getting them about stem cells, getting out at conferences and speaking and stuff like that. So that part has been so rewarding because it's kind of fueling all the things that were making me happy. You know what I mean? And just kind of very like soul filling. And I do miss to some degree being in the clinic, but not as, as much as I thought I would. I think it was just kind of time for a change. And you're right to your previous comment. It's hard when you do work so hard to do something. Like I was fine leaving, but you get a lot of like pushback a little bit from people. And there are people like are loving, supportive people in my life, but I did get a lot of, you can't do this, you worked too hard for this, as though I'm like leaving to do something that isn't as full. So I think getting people to understand like what I'm doing now is just as important, if honestly, I would argue more important than what I was doing before. It's just different. And so I think getting people to understand that, but sometimes clinician vision, they can't understand that. So, yeah, and it has been great to be at home. I've got 2 boys now that are 11 and 8. I feel like the parenting need is strong right now with like a son going into middle school. So it's hard. I mean, like you mentioned, the 2 busy parents, and I always wondered how we would make it work. And we have made it work. We've lived in places where we haven't had a lot of family support. We've had a lot of nanny support and a lot of neighborhood support. But it was, a lot of really long days and draining days. And I was feeling like even when I wasn't home, I felt like I wasn't present, for my kid. I was distracted and irritated. And I didn't want to live my life that way anymore. I wanted that to be the priority. I wanted home. Like they still know I work probably even more, but I'm happy. I'm there for them and I have control over my own schedule and my own life. And like for them to be able to see, that they're, they've always been my priority. For me to be here, there's something with kids about like physically having you there, and I think it's been really good for them.
Yeah, absolutely. Before I forget, the audience is very medical, and if they're like me, they want to go back and get this answer. When you
Wow.
saw some clinical signs of early disease in these puppies, what were they? That if you said it, I totally missed it. But I'm like, what were their signs?
No. So, and the thing is, you wouldn't pick up on it unless you're examining them. And I have amazing videos of like after stem cells in dogs that had this, is that they had diffuse pain if you palpated like through their neck and back, like a common symptom that you would see in the later stage of disease. But you can imagine if you have like diffuse meningeal inflammation and your body's inflamed, you're going to get something from there. Had reduced visual processing on one side, and those lesions have always matched on the MRI. And that is a common sign in people in the early stages. So people will also get this like this hyperesthesia, so like a pinza type of feeling as well, kind of similar to like the spinal pain, and then this reduced visual processing. And then they have reduced paw placement. So like they may be fine, but if you actually check paw placement, it was abnormal. And for a lot of the dogs that never got back to 100% normal, that's one that stayed residual. And in people, one of the early signs of MS is these proprioceptive deficits, so tripping, and they won't even know they have MS. They'll think that they're just like clumsy. It's pretty amazing to see. And then probably about half of the dogs had seizures as well, which is probably the most common sign, that you would see with that condition. And most of them seizure-free, just the stem cells. But then some of them would relapse, and we now have them on anticonvulsants and stuff. So it wasn't all for all of the dogs, but it was a degree of improvement rapidly was there of that, which was pretty incredible to see. So you get them to a much better baseline, even if you need to add in medication. So yeah.
I understand how you could get so passionate about this topic. And again, back to your skill of being able to communicate this, because basically all of that is very confusing to understand. It's confusing to understand multiple sclerosis. It's confusing to understand that disease in pugs. It's even confusing to fully understand stem cells sometimes. So to be able to communicate that to the pet parent, but then now even on a medical level, like I found it very complexing when I first like learned about Gallant and everything. So so I'm sure you see that too, of one, just the awareness of that potential treatment, but two is to like fully understand how could this work, could it be applied to other things, like all of that's pretty exciting.
Where do they come from? What are they? Because there's a lot of really common misconceptions about stem cells based on stuff that's really old. It's not true. And what's interesting, is that a lot of the platforms, it's not new to try stem cells. So it's not something that's not been done before. But what's historically been taking the stem cells from the the donor is the recipient. So the sick animal that's getting their cells back. And there's just a lot of concerns with that, both in like the quantity and quality of cells that you're going to get from that. I mean, if you have an animal that's sick and you're giving them their cells back, right, they're probably not the most viable of cells. And then they go through the process of like getting the cells out, usually from fat, which does have cells in there. Fat's got a lot of other stuff in there. So oftentimes like these stem cell products that are coming from fat aren't really a pure stem cell product. And so the nice thing about Gallant, and this is why I chose to go there, is the company is built on a very scientifically sound platform, and that is to make stem therapy available to any pet that would need it and make sure that they're high quality cells, right? And so getting cells from a donor that is young and healthy that you know isn't sick, we get them from uterine tissue that would be thrown out. I know that it's coming from a sustainable source of tissue versus taking something that wouldn't normally be taken. And there's just stringent quality control with our products because it's all FDA regulated, and so that way when you ultimately have a product, which hopefully come in the future, you know that it's going to be safe, effective, and it's been quality. And so it's nice to feel a part, trying to like set the stage and like lead the future for regenerative medicine in a high quality way. And so try to dispel some of the myths out there that stem cell therapy and regenerative medicine is like the wild, wild west and everybody's just doing their own thing. It's like, not everybody's doing it. There's a right way to do it. We're going to show people the right way, and so it was really fun and exciting, like daily part of that momentum. So.
Yeah, so just out of curiosity, when you're dealing with the FDA and creating a treatment, usually you have to be very specific about like what it's supposed to be used for and everything. And it sounds like stem cells have a lot of possible uses. So where we are today, do you mind sharing a little bit about like what's possible for people in practice to be use, and so that way when they see patients they kind of will have that in the back of their mind?
For sure. So I think most important thing is to make sure we get good research out there on everything. And so, right now, probably the most studied disease, and this is the one that we've also studied the most, feline chronic gingivostomatitis, which is like a really aggressive oral disease that 30% of cats are refractory to treatment and they're miserable. So a lot of studies have been done on those. Before we started, we have a lot of studies going. So really to kind of be able to prove for this condition, like this drug looks safe, it looks effective. And then that process is that to get that drug FDA approved, there are currently no approved donor stem cells, so from healthy donors in medicine. So there's one product that was approved in human medicine last year. And so I think the main thing is to like open the door, right? So you've got to get the drug approved, and that opens the door for various indications. But I think it is important to do studies, indications, and the big problem that we have in veterinary medicine and honestly in human medicine with stem cell research that it's very heterogeneous. So it's like different types of stem cells, different routes, different doses, different levels of severity, no controls, aren't a lot of good, like well-designed studies to look at everything. And you can find like so many indications for, I tried stem cells on this and it worked, so that there's a lot out there, including honestly what I did for the pugs. I'm not trying to say that what I did was really any better. I had a pilot study that I showed in this group, but I think for, conditions that are known inflammatory immune conditions like osteoarthritis, atopic dermatitis, things that we know have this immune component, I think are where it definitely has the most potential. But it's definitely being explored for kidney disease, for asthma, so much in people for respiratory, conditions. So I think, the more that people recognize that this can be a mainstream therapy, the more studies that we can get, the more patients that can enroll. A lot of it is owners will drive it too. They'll drive the enrollment because they're like, hey, I've heard of this. I want to be a part of this, or I want more studies with this. And then once you get more good studies and then drugs that are approved, it really just opens the gate for more therapies over time. But it has to be done the right way. And so I think there are a lot of us who really just want products out there to make money, and not necessarily goals of making sure you're getting a good and verified product that's safe and effective. And so it's hard to do things the right way. I'm not going to lie. It takes a lot more time. It takes a lot of patience, At the end of the day, I think we're all committed to doing it the right way, and I think ultimately that it's going to be better for medicine to be better for the patients to do it that way. So.
Absolutely. And we're very excited for you for getting some great funding coming in so that you can keep doing that mission. So that's super
Mhm.
exciting. And again, as you're talking, I'm
Mhm.
just thinking, oh, how cool that she's continuing to pull in all of these different things that you like to do. Big on research. You are very good at communication and understanding. You also have kind of been an early adopter to, implementing new possibilities in treatment. Because you mentioned one of the things that you're really excited and would love to talk about is about 3D printing. And so you said
Mhm.
you were one
Right.
of the first veterinary neurosurgeons to implement 3D printing. So did you want to share a little bit about that?
Sure. I do feel like I started really, yeah, jumping on the bandwagon of using it. So we had a really cool case, and I remember this so well because this was a rescue dog that came from Arkansas, got rescued. It was a young shepherd, got rescued by a Colorado group, and this dog had, like, for lack of a better term, the messed up back. I remember seeing it, and this was a shepherd, so really atypical, just this weird congenital, not just one place, two places where the back was completely like, and the group contacted us, like, do you think you could do anything? Do you think you could fix this? I look at it, I'm like, oh God, you know what I mean? I was like, I maybe. I said, dog got a little older. We MRI'd and CT the dog, and I was like, I mean, but I mean, the dog couldn't walk. I mean, he was paralyzed, and so it's hard enough to try to like reconstruct a back where the bones are, all, and they're just fractured. You take bones that are like wrong direction. And I was like, I can try to like realign this spinal kinesis, but like it's very uncomfortable. And so at the time I had a friend, a neurologist named Fred Winninger, who started up kind of his own 3D printing company. It was pretty early at that point. And I was like, Fred, if I send this to you, do you think you can make a model for me? So not only did he make a model for me, but he made these little things that have holes in them attached on the bone. And we basically modeled together if we were gonna like realign the spine and put pins, where would the pins need to go? And so these little would they fit on the model, but then you had to trust that those would fit, and you just drive your pin through that hole. And he did such a beautiful job. And I remember that was a 10-hour surgery to try to realign the dog's spine. And I remember, we decompressed and we had amazing pictures of like the spinal cord being so compressed. We opened the canal and had the spinal cord flat, and we got the pins in. I remember, I'm like, this feels wrong because it's not at all what it should be with where you're going if you're used to stabilizing it back. It felt so wrong. But I was like, I'm just going to have to trust that these jigs are where they're supposed to be. And we just did it and trust it. And it turned out beautifully. And the dog now, this is years ago, we probably did this sort of like 9 or 10 months of age. He's probably 7, now running around like a doofus. But yeah, after that, I was like, why would you not have a 3D print? And so Fred has helped me along the way with 3D prints for skull tumors, for atlantoaxial luxation. So I just like write it into the bill, you know what I mean? But yeah, I've always thought it was so interesting. And I'm such a geek. I have some of them like sitting up in my office here, like on the on the shelf. I have some skulls and stuff like that from the print. So like there's challenges and being like, okay, I'm gonna try to do this and this is gonna be really, but then sometimes you're like, well, what alternative is there, right? You have a dog who's never gonna walk again, or you give it a try, and luckily most of the time if I've tried things they've worked out, but yeah, it's definitely nerve-wracking for sure.
Oh my goodness. Well, I agree with you. I think a lot of people who follow this podcast know I'm pretty interested in 3D printing too. And I have a friend who told me that it reminded me because you said the jig that there's a group who is researching how to 3D print jigs for TPLO surgeries. And they have
Mhm.
researched this where they have veterinary students who have never done these procedures. They
Mhm.
practice with the jigs and the models, and they're able to like successfully do these. And
Mhm.
so it is amazing, I think, the future of some of these technologies that we can do.
Yeah.
So definitely
Mhm.
something to
And for
watch.
ordering that, for these atlantoaxial luxations, where you have like the first and second bone luxated, that's probably one of the scariest things to try to have stabilized. And every dog is completely different. A few years ago, I started moving to using these like tiny, tiny little titanium thin screws. But what's awesome is I would get the 3D prints ordered, and so I would see their exact bones in their exact size. But then I'd be able to order the plates off of that. And so I would be able to I'd have in front of me, okay, this is exactly how I'm going to do the plates. And so just what that does for you as a surgeon mentally, having been able to prep, that to that degree, going in surgery in that magnitude is it's a game changer for your anxiety level. And the owners feel more comfortable, you feel more comfortable, So yeah, I'm really hoping, I think that this 3D printing business will explode. I mean, it already is, but I'm hoping that more and more people recognize, the value of having the models. And I think people are going to having, spine models too of, typical size dogs. Like this is where you would be placing your pins and stuff like that, which is so helpful because, we see a lot of imaging that is or CT like in 2 plane. To have a 3D plane that's physically with you is so helpful, So you're gonna be famous with your 3D print, I'm sure.
Oh no. The 3D printing that we do is not medical. It's a hobby for us, but it is a fun hobby too. I know you said your son has gotten into it. Yeah, has gotten into it as well.
He's a hamster named Avocado, and so he is 3D printing a little house for Avocado. And I was like, I hope your filament is safe for Avocado, but yes, he loves 3D printing and is always making little. It's really fun.
That is really cool. And the other thing that you said you would also be open to talking about, and I think this is very important for our profession. It's similarly for men in a way, but it is still different for women because we actually carry the children. But you talked about family and prioritizing them, and you mentioned that even having children was not easy. So since you said you were open to sharing a little bit about your experience, yeah, I'd love to hear.
Wow. No, and I am open to it because I think a lot of people just don't talk about it. At the time, I honestly felt kind of lonely and isolated a bit. And I think for a lot of us as veterinarians, that are overachievers, we're like, well, I'm going to do this and get that and then get that and this and I'll get that. And I was doing the same thing. I'm like, finished my residency when I'm 29, got married. I'm going to start trying to get pregnant when I'm 31. And then I'm like 34 and what is going on, and I'm failing. You know what I mean? I can't do this. And I do think, a lot of it is stress related to some degree, trying to build a practice at the time and working crazy hours. I mean, I thought I was prioritizing myself and my health, but I don't think I really was. We just kind of keep ourselves above water, but I'm like, if I look back, I'm like, really, was I really probably healthy to be getting pregnant and carrying a baby when I struggled a lot with really being able to have any sort of normal pattern to be able to get pregnant. And we were so blessed though, in that we are medical, and so we were like, okay, again, this is a problem. How do we fix it? And we were able to meet with some of the best doctors, I think, in the world, reproduction specialists, and get a solution, you know what I mean? And end up going through IVF for both of our children. And so I feel like we're really lucky. I mean, it can be so expensive, and so even though the process is certainly stressful to go through, when I look back now, I feel blessed, that we got 2 healthy children, and I actually had pregnancies and easy deliveries and stuff, and reasonably good children. They're wonderful. So, but I feel like oftentimes people look at us and be like, oh, perfect little family, and and I feel like you have to tell people we fought for this family. The kids were not just given to us, and everyone around me who just seemed to get pregnant, naturally right away. I was like, with me. And so there's a lot of guilt with that too. What is wrong with me? Why can't I get pregnant? What am I doing wrong? You know what I mean? And then as a busy professional, you do get a lot of you work too hard. You're starting to get the mom deal, and you don't even have kids yet. It's just so you're trying to do all of the things. But yeah, I think it's not an uncommon thing in veterinary medicine because a lot of us are in school for a long time and then we're waiting, to start our families. And it's oftentimes not super easy. And, but yeah, I think ultimately we were able to get where we were, but it's hard going through all that too, while you're working and all of that.
Yeah, I agree. I think we are extremely hard on ourselves in general, and then to have something also that emotional that we're beating ourselves up over, and we're giving our bodies a hard time, and women are notoriously hard on ourselves for our bodies. And so, I mean, it's like a lot of things all kind of wrapped up into one. And my story is not that different. I got married at 29, 30-ish time frame too. And I, got pregnant when I was 35. So I was considered advanced maternal age at that point. So
I think that's what I learned about advanced maternal age.
well,
Yeah,
it's better than geriatric. So
that's
I'll take
good.
advanced maternal age.
Yeah.
But I never want anyone to feel lonely, but it's a hard one to talk about because there's so much emotions wrapped around it. And then at the same time, if you talk about wanting to get pregnant, then they're like, oh, then she's going to leave. And, like there's just so much that we can guilt ourselves over it.
Yeah. And I feel like it doesn't get easier after they come either. I will say one thing always gave me a very good sense of gratitude to be able to have children at all, and always try to remind myself of that, But it's hard. The mom guilt is strong, and I always wondered how we would balance it with hours that we had, and I looked for examples. I struggled to find them, honestly, of anyone where both parents were working the hours that we're working with the level of on-call that we have. How are we going to actually make this work, And we managed to get through it, but you do have a lot of guilt, and you do have a lot of sacrifices that you need to make. And over time, you do start beating yourself up. And I remember making a shift, though, because it used to be a lot of me apologizing to them. I'm sorry, I'm late, or I would never be late. They were always taking care of it. I was like, I'm sorry, I missed this, or I can't come to party at 10 on a Wednesday, or, things that are just really hard to do. Or a lot of it was weekend stuff. I'm sorry, I can't go to this because I'm getting called in, And I got to a point a few years ago where you know what? I'm done apologizing. I work really hard. Because I work really hard, and obviously my husband, my kids have an amazing life, they want for nothing. And what I'm doing is important. It's not like I'm missing out on that, go get a pedicure, right? And so instead of apologizing all the time, I just started telling them why, instead of I'm sorry I'm missing this. I'm I can't go to this today because I need to go help this dog who can't walk. And I would send them pictures, of the dog. And it's interesting how much I saw their dialogue shift too. Whereas instead of comments, my mommy works all the time, or, they knew I was a vet, but they would be like, my mommy fixed this dog, his back was broken. Mommy took a tumor out of a dog's head. And I told them what I was doing and why it had to take me away from them. They understood and could value the fact you have a mother who works, and she worked hard to get here, to get educated, to have this, and you should be proud. And hopefully you'll treat other women that way, and your, wives, if you have wives or whatever, and really just kind of change that. So that being said, I didn't feel like I got to a point after doing it for many years, for most of their life, where I did kind of start feeling like I was done with that, of being pulled away. And when they're little, not that they don't miss you or remember you, but when you're missing football games and you're missing stuff that really matters to them, then it's just you know what? I'm not doing more. You know what I mean? I'm going to be here. I'm going to be here for them. I'm going to be there for the moments that they need me, and not have a nanny, be the one that's there for those kind of bigger moments with trouble at school or with friends or helping with homework, that sort of thing.
Yeah. Well, I'm very excited for your new step with Gallant, and I can feel your enthusiasm. I think they picked an amazing person to keep these projects moving forward. So congratulations. And I look forward to kind of watching your adventure at Gallant. The last question that I always like to leave, and you already started to get in there, was what is something you're very grateful for?
Very poor. Yeah, I think I was kind of already getting there. So I think honestly, I'm just really grateful for the people that I'm surrounded by. So part of that is my family, friends, my work family. I've really been blessed to be in environments with just a sort of people, and they allow you to do things that are really hard. You know what I mean? And when you feel supported and you feel valued, it makes you happy. You know what I mean? Because it's not the work, the work is hard, but if you're willing to do it, if you're motivated by the people. So really do count my blessings every day for the people that I have around me.
I love Dr. Rebecca's energy and enthusiasm. Our conversation today shows a few key insights. Careers can evolve in amazing ways. Stem cells are opening new doors for pets, and it's never too late to align your work with your passion and priorities. To learn more about regenerative medicine and stem cell therapy, check out Gallant.com. Thank you to Dr. Rebecca for being on the show. Also, thank you to you podcast supporters out there. A big thanks to Dr. Kelly Cooper for supporting this podcast through our Buzzsprout platform. She's an amazing person, just like Dr. Rebecca, and she's a great speaker and coach. If you enjoyed this episode in the podcast, please follow the show, leave a quick review, and share it with a friend in veterinary medicine. And until next time, let's keep reimagining what's possible in veterinary life.